Hey everybody, what's up? It's your girl Nicole with Real Talk Recovery. Welcome back to another episode of Real Talk Recovery. My name's Nicole and I'm a person in recovery. My sobriety date is July 13th, 2015. Tonight, you guys, we're going to have a special guest on. Her name's Mel, I think. Her name's Mel. I know her as Spoonie Mel here on TikTok. And we're going to talk about chronic pain. So we're going to talk about chronic pain and we're going to talk about addiction. And we're just going to talk about how there's I really want to talk about how there's this need to blame somebody for what's going on in the world today. And what happens is it kind of pits addicts against chronic pain patients. A lot of people that have chronic pain blame addicts for there not being, opiates available. They are angry with us. But really, it's not our fault. If we're going to be mad at anybody, we need to be mad at these pharmaceutical companies, because they're the ones who came down here and lied in the first place and started this whole thing. I'm really excited to have Mel on. I'm an advocate for people that have chronic pain to be able to have their opiates. I believe that, if somebody has pain in their life, they shouldn't have to live in pain. You know what I mean? That's torture, dude. Who wants to live like that, So she's going to come on and we're going to talk about that tonight. So y'all come on in and hang out with me. Let me share this video too. Hold on. Hey girl.
Hello.
How are you doing?
My head hurts, but I'm alive.
I have migraines too, just so you know. So I can't believe that you're doing this. I hate when I have a migraine. I have to be in a dark room or I have to eat a bunch of caffeine,
Yeah, for me, it's ice on my eyes, ice on my head. I'm coming down though, so this is the third day, so it's tapering.
Good.
It's
Okay,
not
so
bad.
is your first name Mel?
Melissa, but yeah,
Melissa?
you could call me Mel.
Okay, I'm
And yours
Nicole.
is
Nicole.
Nicole. Yeah.
So the reason why I wanted to have you on tonight is because I saw the back and forth that was going on with you and Kyle from Sober Dogs, and I've known Kyle for 4 or 5 years now, and he's such a sweetheart. He means well. I really think he does. And I used to be the same way. I used to think the same way too. I thought that opiates were horrible and that people shouldn't be on them. But I've changed my mind and my perception a lot because of watching other people here on TikTok and hearing people that have chronic pain, hearing them speak about not being able to get their prescriptions. And then also I work for a doctor that prescribes some pain medication and then some addiction medication. And we get phone calls every day from patients who have their doctors who have just totally abandoned them and just, sorry, I can't prescribe this to you anymore. See ya. And it's horrible. I sit on the phone with this one lady just the other day for an hour, and she was just sobbing because she did not know what to do, where to go, or who to turn to get help for her medications that she needs for her debilitating chronic pain. I'm talking this woman's had spinal surgeries and stuff, So I wanted to talk to you about that, and would you share a little bit of your story with us and share with us how you found out you had chronic pain?
Sure, absolutely. Well, first of all, I'm glad you invited me to do this live tonight because I think it's important. I think there's too much blame that gets tossed around on all sides, And the truth of the matter is we all have a common enemy, and that's the people making the rules.
Right.
Addicts didn't create this. Chronic pain patients didn't ask for this. There's too much blame. So for me, it started several years ago, like eight years ago. And it really kind of was like a fluke thing. I was just doing what I normally do and went down. I just went down. My whole body went paralyzed, basically, paresthesia. And that started my journey. And if you know anything about a lot of chronic pain patients or chronic illness patients, a lot of us go through a lot of years of misdiagnoses or being made to feel like it's in our head or, whatever it may be, medication, medication, medication. And I went through that too. I had a neurologist that kept telling me that I was having migraines that were mimicking strokes. And it was one migraine medicine after another. And those medicines really messed me up, like
Yeah.
mentally, you know. What it turned out to be was that I have degenerative disc disease. I have major spinal issues. So, like I said a minute ago, I've had 5 spine surgeries. I've had 2 fusions in my neck, 2 discectomies on my lower back. And in last May, I had another fusion on my lower back where they went through my stomach to fuse my spine.
Wow.
And most of us don't just have one thing. So on top of all of that, I have a few autoimmune disorders, the main one being CIDP, which is a type of neuropathy. And it's like having MS in your peripheral nervous system. The protective coating of my nerves, it's basically disappearing. You know, my nerves, they get so inflamed that that coating breaks and kind of falls away. And that causes tremendous pain too. So for me, I am lucky because I do get treatment, but there are millions of people that don't, and more people every day. And even when we do get treatment, we live in fear. Like, how am I going to tell my doctor that this isn't working well enough? How am I going to discuss that with the pharmacist? How am I going to, you know, because you're constantly living in fear of this stuff getting completely yanked away from you. And I've talked about it a lot on my page. Hi. But there is something called a NARC score. Do you know what that is?
Yeah, so I know that they ask you questions, and I did some research after seeing the lady C. Miranda, Don't Punish Pain rally. She was talking about how like if you have been RAPED'd and they know about it, like that puts a notch on your score to where they won't prescribe you opiates, right?
So it's a PDMP. It's a database
Uh-huh.
where anybody who's had narcotics, stimulants, steroids, any of those types of medications, you're automatically put into a PDMP, which is a database of these patients. And your NARC score is affected by a million things. So it's not just if something really bad happens, it could be saying the wrong thing. I have chronic pain patients who have been red flagged by their pharmacy because they called a day earlier than they should have to refill their medication. We get drug tested. We get drug tested all the time. We have no idea when it's going to happen. Sometimes it happens every appointment. Sometimes you'll go 2 appointments without. Most of us have to carry our pill bottles with us because if they say, I want to count your pills, we have to hand our pills over. So I understand why a lot of pain patients get angry and they think it's the fault of addicts.
Yeah.
Is because they think that people who got addicted to this stuff, they made a choice. And what I try to educate people on and tell them is it is not a choice. Addiction is a disease. And we have a lot of very good studies out now that show that there's a genetic component to it, you know? So anybody can become an addict if they're exposed to the right thing.
Yep.
So,
I was born an addict. I was an addict before I came out of my mama, okay? Like, for real. It runs in my family. All of my aunts and uncles have either been to prison for, like, cocaine, selling cocaine, manufacturing drugs. Then on my dad's side, his dad was an alcoholic. My mom's dad is an alcoholic. And so I, like, had the disease of addiction, like, the genetic predisposition for it. And then the moment I tried like a drug that, like alcohol or marijuana, the first time I ever tried a drug was a prescription drug that was prescribed to me was when I got my wisdom teeth pulled out. No, it was when I got phentermine. I got phentermine when I was like 15 or 16 for weight loss. And then I got my teeth pulled out for these wisdom teeth. And they gave me, I think, like Percocet or something like that. But the moment I took both of those drugs at both of those ages, I knew like, dang, this is great. It makes me feel good. And it makes me feel like I can do things. And like already it turned that on in me. Do you know what I'm saying? Like I was,
Yeah, I get that.
it just took one time.
Addiction. I have a lot of addiction that runs in my family too. Um, I get it. I've seen the other side of it. You know, I've watched both sides. I've watched my dad practically kill himself with an alcohol bottle.
Yeah,
So I definitely get it. Um, and that's why I think it's important that chronic pain patients understand that it is not a choice. You know, you don't wake up tomorrow and go, you know what? I'm going to be addicted today. Nobody
right,
would choose that. Like we wouldn't choose to be in pain. I think something that a lot of chronic pain patients want the recovery community to understand is that these medications don't have the same effect on us.
right,
So, because our bodies are in constant pain, and those, those little pain signals are going off in our brains, the medication doesn't give the majority of us any kind of euphoria, any kind of energy, any kind of high. It allows me to be in slightly less pain so that I can get out of my bed. But we don't get that high from it, you know. And I think that's a misconception, and that's why a lot of people will come to us and tell us that we're nothing but addicts because we take medication. So
it's kind of
yeah.
like I guess you could kind of equate it to a person who has ADHD, and when they take their Adderall, it doesn't make them high, it just makes them normal. Do you know what I'm
Yep.
saying? And if I took
Yep.
Adderall, it makes me all bouncing off the walls because my brain doesn't, I don't need it. Like there's nothing going on in my brain that I need that substance to be in my body. So I guess you could kind of compare it to that, huh?
Yeah, very much so. And I've compared it to like Xanax before. So I have really bad panic disorder, and I had that long before I was a chronic pain patient. And like people would say, "How do you even function when you take Xanax?" Because well, it doesn't make me tired. It just helps me focus. You know, it helps my panic disorder go away. Yeah, people are saying here that's why I'm such an advocate for Matt. Absolutely, and that's something that's really big too because Pam and I both say this a lot. Pam is in pain stigma. You never know when you have lived your last good day. Anybody can wake up tomorrow and become a chronic pain patient.
Right. Yeah, I totally
Anybody
believe
can
that.
get in a car. I mean, look at COVID, for instance. There are a number of long haul COVID patients that are now chronic pain patients. Um, and that includes addicts. Just because somebody has a history of addiction doesn't mean they're immune from becoming a chronic pain patient. There
Girl,
are a lot of chronic pain
if
patients.
I wanted to go to the hospital today and get treatment for pain, they would laugh me out the damn hospital.
Yeah,
They wouldn't even
yeah,
give me a
that's not
chance.
right either.
I'm
Yeah,
trying to
and
get
that's
I'm trying to get help for my weight because I'm obese and I am begging my doctors, please help me. I need help. I can't do this on my own. And they are like, well, we can't do this, we can't do that because you're an addict. It's like, and I've been sober for 6 years. It's like it puts a fucking like a stop sign on my head and I'm never going to be able to live it down ever. You know what I mean? It's so discouraging. So
well, and that
we're
happens
fighting the
to us
same fight, like
exactly.
chronic pain patients and addicts, you know?
We really are because I'm sure everybody here knows that a lot of my videos have been about treatment in the ER. If we walk into the ER and disclose to them, which we have to, right, that we're a chronic pain patient or that we've signed our contracts with our chronic pain doctors, which is another aspect that we have to go through. They immediately dismiss us. It doesn't matter if we tell them the pain is much worse than normal. It doesn't matter if we tell them the pain is in a different spot than normal. We are pretty much laughed out of the door, just like you guys are. So for our communities to be fighting each other rather than coming together and figuring out how we can all fix it, there's a lot of overlap here, you know?
Yeah,
There's
totally.
a
Can you tell me, because I knew that you and Kyle were we're talking about opioid induced hyperalgesia. What is
mm-hmm.
that? How does that happen? And like, is there studies that say, like, I don't think that, I mean, I'm sure there are studies that show that, some people do better without taking opioids and some people do better with taking them. But
So
like,
there's really no. So
Okay.
there's really no comprehensive studies on this. And that's why that argument in itself infuriates me, because Dr. Kolodny, who is one of the people in the CDC that have come out against opioids for all uses, he's one of the people that wrote those 2016 guidelines that had millions of chronic pain patients kicked off their meds. This is something that he argues a lot. There are no conclusive studies. They did one study on rats where they only used morphine.
Uh-huh.
Well, a lot of people don't react to morphine at all. So you can't take morphine to equal all opioids.
Right.
And even that, it was a small number. They've had studies where they're not clinical studies, but observational. And in those studies, they've used more recovered addicts, people with just acute pain issues than they've ever used chronic pain. And even with all of those, they still say it's a phenomenon that can happen in some. There's zero conclusive evidence that this happens to everybody. And there really isn't anything that's clinically studied, especially on chronic pain patients. So it's one of those arguments that the government uses against us as a justification for stripping people of their pain treatment,
I can't imagine I can't imagine like being like legitimately in pain and like doing everything that I'm supposed to do by the book, and then go into my doctor's office and him being like, "I'm sorry, I can't prescribe you this medication anymore."
And it happens every day.
You know?
Every day I have at least one person that says, Mel, they cut me off. They kicked me out. They released me. They relieved me from the program. And the unaliving, the rate of unaliving in the chronic pain community has tripled in the last few years. Because I'll be quite honest, if I have nothing to help me with my pain, I can't do anything. So what's the point?
Yeah.
And that's something a lot of us face. And there's a lot of people who have much worse pain than even I do. So it's
I think what it is, I think like, people, we can't see people's pain, and so it's hard for like I feel like doctors and the CDC or whoever, they need to like just put some safety guidelines in place, and then but understand that each person is different. And so one person can say, I feel like I have a 7 on the pain scale, and a 7 to me could be like a 9 to you. Like that's the thing. Like, how do you differentiate that? You just have to trust the person.
Also, a lot of chronic pain offices, and I know not all of them do, because some of you guys have told me that yours don't do this, but a lot of chronic pain offices or pain management offices use the chronic pain chart. So it doesn't stop at 10. It keeps going. Like on the chronic pain chart, a 10 is like nowhere near the worst we can get. I can still function on a 10.
Because y'all are used to because you're used to pain. Because you become used to it.
When I'm having the worst day, I still get up, I get my kid off to the bus, and then I lay down and cry about it. But we have to learn to function at higher levels because we live with them every day. So I think that it would be really good if it was universal. ERs don't know anything about a chronic pain chart. They might learn about it briefly in medical school or nursing school, and then they forget all about it. And it's this 1 through 10 chart, which is so inaccurate as far as what typical chronic pain patients live with,
Okay, I've had pain before. Okay, I'm going to compare it to this. So when I gave birth, that's the worst pain I can think of. When I gave birth, they gave me an epidural, the fentanyl epidural, because I seen it. It was right there in the bag, and it was like a liquid. And it was the best thing that ever happened to me. It made my legs completely, I couldn't feel them. My stomach was like, I couldn't feel my stomach. Everything was great. And I pushed my baby out, and it was easy after I got my epidural. Like that, to me, that pain wasn't a 10. That was like, a 6 or 7. Like I could have handled it. It could have been worse for me. You know what I mean? Like I could have handled more, I think. Um, how do you, I don't know. I don't want, I feel like I wanted to have you on here because I want people to know that there are people out here that support opioids and opiate use. Like there is therapeutic value for people to use opiates because people need them for their pain. I never want anybody to feel like I don't support them in the medication they need to have a life. I take Suboxone. That medication saved my life. If I don't take Suboxone, or if I decide to jump off of it out of nowhere, I could go out and relapse and die. Like it saved my life, you know?
Well, and so you know, it's starting to hit the recovery community too. Pam and I we have a GoFundMe up. You can look on both of our pages for a doctor who is targeted by the DEA. He is a MAT specialist. He specializes in treatment for people in recovery, and he is now being targeted and has to go to court and is being charged with crimes. They are coming after everybody,
Yeah.
and a lot of times I have people that are super pro medical marijuana that will come and attack me, and I wish marijuana worked for me. I wish to God marijuana worked for me, and I wish it was medically legal at least everywhere. And I wish that if insurance companies are going to kick you off of opioids and make you use medical marijuana, they would cover the price, because
right.
a lot of them can't work. So yeah, they're starting to come after MAT doctors too, which is scary.
Yeah, it is. Can you
It's
imagine if
funny
they
is
cut
that,
us off? If they cut MAT people
right,
off their medication, it's going to be bad. Like there's so many
scary.
people that are on Suboxone and methadone, like it would be overdose, overdose, overdose. I've heard that they're trying to make you guys go on to Suboxone. Well, how do you
Yep.
feel about that?
I know that there are a lot of people who actually get more relief from methadone
Yeah,
than they
yeah,
did from their regular pain meds. Um, I don't know. I think that everybody needs options,
yeah,
Everybody needs the option to try medical marijuana. Maybe it won't work for them. If that doesn't work for them, they should have the option to try kratom, which the FDA is trying to get rid of that now too.
yep,
If that doesn't work, we should have options. It shouldn't be this works for everybody, because that's never going to be the case, right? That's why there's 20 different medications to handle somebody who has high blood pressure, because not one works for everybody universally. I do think it was funny that you said about when you gave birth, because on really bad days, I either tell my husband I want to chop a certain part of my body off, or I say I would rather give birth 10 times with no medication than live this way, because that is how bad it can get. And it's hard on our families, just like it's hard on the families of people who are going through addiction. And like I said, I have family members who I've watched go through it really, really badly too. So it's hard on all of our families too, right? Because
yeah,
just like people who have addicts in their family and they just want to help them and they just want to make it better, and our families go through that too. They feel helpless. They watch us writhing in pain. They don't know what they can do, so there's so much crossover between our communities, and the blame game is just, in my opinion, and I'm not like super conspiracy person or anything like that, but I think we spend so much attention and time blaming addicts and doctors,
yeah.
right? And a lot of addicts blame doctors. No,
They do.
I
I
understand
hate
that.
that. Like I
And
despise that, just so you know. I
a
hate when
lot of
people do that.
addicts come and blame us. I can't even tell you how many comments I have gotten where people blame me for them being addicted, because if you weren't fighting to keep these, nobody would ever take them, you know? But the reality is, the people who are hurting our communities are the ones that are making the rules and the
Yeah.
ones that are making the money. That's who is.
I don't
It's
blame doctors at all. Like I work for a doctor and he's the best doctor in the whole wide world. I think he's amazing and I support doctors. Like, and I don't like it when I see people like saying, I blame my addiction on this doctor. This doctor prescribed me this, that, and that, and this. Those doctors, when they were prescribing that back in the 90s, especially, they were told. Did you see that video that I want everybody to see? It's on Hulu. It's called Dope Sick, and it talks about how Purdue Pharma went around like telling people about OxyContin and how only 1% of people would become addicted to it, and they like went all around like wooing these doctors, paying for their stuff, buying them food, and then the doctors were like, "Oh, this is great. I can help people, and this will help their pain, and I can prescribe it, and only 1% of these people will become addicted." And so like
Yeah.
we should stop blaming doctors and each other, and like you said, the big wigs who are making the cash money, who
Yeah.
are
Well, and I don't know if you've seen the video I made about the House resolution that was introduced at the end of May. It hasn't been voted on yet, but it's introduced. They've now introduced into Congress a bill that would pay doctors, financially compensate doctors to not give patients any type of opioid treatment during or after surgery.
surgery. Like, why wouldn't you
Surgery.
want? I've heard people saying they broke their arm and they went to the emergency room and the doctor wouldn't give them nothing for it.
No, and we've seen so many people who are 90, 95, 98 years old, and the doctors refuse to give them any opioids because they say there's a risk of addiction. If my 98-year-old grandma is in enough pain that she wants a pain pill, you better give it to her.
Right.
That's
Right.
ridiculous. And now there's a whole thing a few months back that was introduced in Seattle in the state of Washington, where they're no longer going to allow opioids to be used for children who are in pain, who have had surgery, who cancer patients. A lot of people say things to us like, well, at least you don't have cancer, or oncologists wrote 50% less prescriptions for opioid pain medicines since 2016. And a great number of those patients cannot find a pain doctor to treat them either. My own doctor, I have a lot of blood issues, so I go to a hematologist. And most hematologists are also oncologists. And he asked me the last time I went and saw him, he said, how is Dr. Aparque? How is your pain doctor? Does he treat your pain? Does he take care of you? And I said, well, yeah, he's great, And he said, I have so many patients who can't get any treatment for their pain. I'm going to tell them to go see him.
Yeah.
Cancer patients. We are torturing people for what? For what? The ODs have not gone down, they've gone up.
I know. Well, first of all, most doses are from multiple substances. Like when us addicts mix things like opiates and benzos, you know what I mean? Or now with the fentanyl, illicit fentanyl, like that has stepped up a lot, but that's like coming off the streets. That has nothing to do with prescription
Right,
meds.
and that's an important differentiation too, right? The CDC says whatever they want to say, but when you actually look at the charts they have, they demonstrate the fact that most overdoses are happening from synthetic drugs that are coming off the street. We are trying to put opioid pain medication on prohibition. No more. Not going to make it. A lot of us are even having trouble getting our prescriptions filled if we do get them, because our pharmacies they're not getting the medication in. They don't have it to give us. So they're doing this. And in the meanwhile, what are they doing to stop all of these synthetic drugs from coming from China, from, pills that look exactly like the ones we take but are not real? Things like that. They're focusing on the wrong thing, and they're hurting millions of people in the process of doing it.
Have you had any problems with your pharmacy trying to get them to fill your meds?
So I almost did the last time. He told me I was really lucky that was the specific day I was filling my prescription, because he had been trying to get it in and had just got one single bottle of my medication in. And I don't even take like the highest opioid. all honesty, I take Norco. It's
Uh,
not the highest opioid out there. But even that, he's having trouble getting into the pharmacy. The DEA controls how much of these medications are produced each year. And they have cut the production by 25% every year for the last several years. So yeah, even if a pain patient is lucky enough to get treatment, they might not be lucky enough to get it filled. And then if you can't get it filled at your normal pharmacy and you try to take it to a different one, they can red flag you for that. You can be red flagged for going from one pharmacy to another. You can be red flagged if you decide that your doctor and you, like, we've all had doctors, right, that we just don't like, we don't vibe with, so we switch to a different one, a different primary, whatever. If you do that as a pain patient, you can be red flagged as a pill seeker. So it's really, really difficult for us to get treatment. And I think that, yeah, I think it all needs to be understood. You know, I've always said, and that's the only reason I got upset with Kyle, quite honestly, is because he said that I was blaming him. I do not, will never. I always tell, and some of my people that I love, they get mad at me, right? Because I say, we're not blaming the doctors here. We're not blaming addicts here. The blame doesn't fall on anybody's shoulders except the people that are making the rules.
yeah. Yeah. Well, it's dividing everybody. Like we're all on the same team. You know what I mean?
And they count
Um,
on this. They
they
count
that's
on the division.
that's what they're trying to do on purpose. You know what I mean? So that way
Mhm.
people will be fighting against each other, and it's unfortunate. Like I have to tell you though, like I used to be gung ho, like I was like opiates, they are the devil, nobody needs them, that's so dangerous. And it was I had came onto TikTok, and then I met a couple people online that would tell me like, you know, they were not addicts and they were struggling. It made me feel horrible because I was like, basically I was just thinking that everybody should be treated exactly the same, and that would be like, how could you do that? I mean, I wouldn't want to be treated the same as another person, you know. And so I changed my perception on it really quickly, and I'm trying really hard to like move towards not speaking and saying things that are like scaring people from taking certain medications, because I used to be like you know, really, I don't know, I just used to be really like scary with things like that, and I don't want to be like that because I don't want to target anybody or make anybody feel like they don't belong.
Well, and I get where that comes from. You know, I think we should all be able to understand where that comes from. I think we should all be able to understand why somebody who went through hell to get through an addiction and will be considered an addict. I mean, you guys have to go through that, right? For the rest of your life, you're an addict in recovery. I think that we should be more understanding of where those ideas come from, which is why I try really hard to just educate. Like, this is the other side. You know, I get where you're coming from. This is the other side of the token. And I really appreciate you wanting to do this tonight, because it's super important that we can talk about these things, you know. And you're right, the division, that's what they want, because as long as we're all fighting each other, nobody's fighting them.
Right, right. It's unfortunate. Like I wouldn't want to have chronic pain. You know what I mean? I wouldn't want to be in pain all the time. So I can't even imagine what it's like, but I know I don't want to be in that situation. And I have empathy for others. That's the thing. A lot of people are so ignorant. They don't even take the time to try and put themselves in somebody else's shoes. Like try to put myself in your shoes, being a mom, being in pain all the time. Girl, I'm going to tell you right now, if I was in pain all the time, I wouldn't do shit. I would be in my bed 24/7, 24/7. Do you know what I mean? Because I couldn't handle it. I can't do it.
I want to, yeah, you know, we humans are great at adapting. I would have thought 10 years ago that I could never handle this life. I would have told you I'm not strong enough. Like, there's no way I could live that way. But we adapt and we adjust because we have to, right? But it's doing nobody any good to be fighting and blaming, you know? Because that's the other thing too, right? Chronic pain patients probably need to recognize that just because whatever medicine you're on right now is not something you are addicted to, that doesn't mean that should your medication change, that new medication might trigger an addiction. You know, it's nothing is 100%. Anybody can wake up tomorrow and be a chronic pain patient. Anybody can wake up tomorrow, get their pills changed, and end up addicted. It's just such a fine line, and it's hard. It's hard because I know where the anger from chronic pain patients come from.
Yeah, I can understand.
But I also know where the frustration and anger from people who have fought for their lives to recover. You know, we have to understand too that just as we fight every day to have a life, you fight every day to have a life.
Right.
I know that every day for somebody in recovery is a fight. It's a battle. At least the ones I know in my life, you know.
Yeah, it's a battle in my mind is what it is. It's my own mind. My mind is going against me. Like there's always this like little you could go out and take some Xanax and then nobody would know, or you could go do a line of meth and nobody would know. It's like having addiction is like having multiple personalities. It's like having two people inside of one body. It's like having your addiction side and then your side that's not addiction. The good and the bad. It is difficult, but I practice staying sober every day, and I practice like helping others and being around people that are in recovery, and that helps me stay sober.
That makes sense. I mean, I think that every day is a battle for us too, that's very similar to stuff that we do. Like we talk a lot about masking. I can mask. I can walk into a room and put on a smile and pretend that I am just fine because I have to. I don't want anybody to go, "Oh, Melissa, I'm so sorry. Oh, Melissa, I wish I could fix you." I don't want to hear those things. So instead, we put on a fake smile. And then when we leave and we're by ourselves again, we cry because that masking just made our pain 10 times worse. So we kind of go through the same thing. We're kind of two different people. We're fighting off letting the true pain that we're feeling show through, which I'm sure is, and you guys have to fight that too. You have to fight that you fight from letting the world see that you are struggling when you are,
Yeah, it's both. It's hard for all of us, and that's why I wanted to have you on, to talk about it. And I want people in the chronic pain community to know that, like, I'm there to support them, and that I won't judge you if you have to take medication. Like, anybody is welcome here with me to hang out and do our lives with us and stuff. Like, I accept everybody. It doesn't matter what medications you're on, or if you use medical marijuana, or if you take kratom. Like, I don't care. I'm just trying to help people to like improve their life overall. Like, it could be with anything, like just improving your overall daily life, quality of life, like with pain, with recovery, with your family, with your self-esteem, all that kind of stuff.
Pain Crusader asked if you can talk about the difference between addiction and physical dependence.
Me? Okay, so to me, there's a difference between addiction and dependence. So with addiction, with addiction for me, you have negative behaviors, and it's a compulsion to use that substance, even till you don't stop using it. It's not like whenever you're a dependent on a medication. Like, I'm dependent on my Suboxone. I take it every single morning as it's prescribed, and then I go on about my business. When I was in my active addiction, I was lying, cheating, stealing, manipulating, overtaking, selling, trading. I mean, it was just horrendous. And so, yeah, that's the difference. I think, some people can be dependent and then become addicted, and then some people are just dependent And then now I used to be addicted, but now I'm dependent. It really has to go with how the behaviors and if you're taking your medication as prescribed and if you're what your intentions and your motives are behind taking that medication. Like a person that is an addict can take medication as prescribed and can put a safety plan in place so that way they can use medication to help themselves. But it's if my motives behind taking medication are I want to get high on this medication, so I'm going to take 3 or 4 at one time. That also, plays into it. So the behaviors, though, are the defining factor, I feel like, with addiction and dependency.
And I think that's a really important distinction too. And I've talked about that extensively also. We do become dependent on our medication. Absolutely, we do. I've been taking the same medication for 4 years now. But as much as I'm dependent on my pain medication, I'm also dependent on my nerve medication, my muscle relaxers, my everything else I take too. If I just stopped taking any of them, I would have issues. But I don't go seeking,
Right.
and in complete honesty, we've all had moments where we ran out a day or two early because we had a really bad day that we couldn't get through. I don't go seeking or searching for something if that happens.
Right.
I am angry at myself because then I have a day or two of torment, but we don't go seeking it. However, a lot of chronic pain patients, because 10 plus million, and I'm sure the number is even bigger now, 10 plus million chronic pain patients have lost their treatment. They get no pain treatment, or they just have gabapentin thrown at them. And a lot of them have turned to the streets.
Yeah.
Because what are you going to do? There is no quality of life if you cannot move without screaming in pain. So I think what they've done is they've created even more problems by cutting all the pain patients off, because now you have pain patients running to the streets, and I don't know anything about street drugs. I don't know a single thing about street drugs. And if I had to turn to street drugs, I wouldn't know what the limits were or how to use them or where to safely get them, and that's creating an even bigger problem. That's why ODs are going up and not down.
Yeah, you would probably die if you went on the streets. If I went out there now and took drugs off the streets, I would die too. It's not the same as it used to be back in the day whenever you could go out and get pills and they were what they said they were. Like now, it's all fentanyl, so it's not even worth it, man. It's not worth it. But what do you think about when somebody was dependent on their pain medication? So when they turn to the streets, is that behavior of turning the streets, does that convert that person into addiction, or would we say they're still dependent?
I would say they're still dependent. I'm sure some of them do turn into addicts. I mean, those type of drugs are a lot different than the controlled ones they take. But I would say they're still dependent because they're searching for something that is going to allow them to function in life. And like you said, if I turned to the streets, I'd die, because we don't know anything about it. We don't know the limits of what we're taking or where we can safely get things, if there's even a safe place anymore. We don't know, and it's really scary. I saw Court TV had a thing yesterday about the comedians. I think there was 4 of them.
Oh,
they
yeah,
were doing cocaine, and they didn't know it was laced with fentanyl, and 3 out of the 4 of them died. I mean, Pam said, nope, that's still dependent. That's looking to function. Yeah. Yeah, don't really look.
I wonder if there's people out there who have been able to go to the street and get like heroin or some other kind of medication and then take it like just to get their pain to go away. Do you know what I'm saying?
Heroin, it's interesting that heroin, and Pam, you're going to have to tell me exactly how to explain this again. Heroin is actually a much better pain medication than anything we're given from a doctor.
Oh, I believe it.
Because I hope I'm remembering this correctly. The length of time it actually works is much better than ours. You know, I can take my pills every 6 hours. Well, in 3 hours they wear off.
Yeah.
Most of us know that, you know. So Debbie said, as long as you're still treating the pain. Yeah. But I think too that the other aspect to chronic pain patients, and especially the ones that are having to turn to the streets now too, is that chronic pain causes depression and anxiety. It's just comes with the territory. There's nothing I can do to not be depressed over the body I'm living in. And a lot of us already deal with that before we're pain patients, right? So like I said, I had panic disorder before I ever became a chronic pain patient. We have to make a choice. Most of us have to make a choice. They will not let us treat both anymore. So for me, it was,
Yep.
are we going to continue to treat your panic disorder and not treat your pain, or are we going to treat your pain and you're just going to have to figure out how to live with your panic attacks? Because they don't let us do both anymore. Even though lots of doctors have said there is a safe way to treat both, they just don't. They won't let us anymore. So now you're having people that are searching for something to help them with something, whether they're looking to help themselves through their pain or they're looking to help themselves through their anxiety. They're all searching for something because there's just no comprehensive treatment overall, you
Yeah.
know?
Well, I know that you can use opiates and benzos together safely, just by like not taking them close together, you know, like spacing it out and like making sure that your a dose of opiates is not super high and or the benzos either. I mean, there's with Suboxone, I know you can take that a benzo with Suboxone safely. Now with methadone, if you were on a benzo, you would like need to take your methadone in the morning and then maybe like wait until the evening to take your benzodiazepine. So that way your methadone isn't at its peak, you know, peak working, you know, like the peak amount that it is
Right.
in the system. So that way you don't,
Right.
you know, overdose or whatever. But that I've noticed that a lot lately because the doctor I work for, we're getting hundreds of calls every single week about people who are getting cut off their benzos, and now they need somebody to do a benzo taper with them. And then these doctors have no idea how to do a benzo taper, and so they're like basically putting these people into like protracted withdrawal and all kinds of stuff, and they're hurting. It's bad. It's really bad. It's
Yeah.
so discouraging because it's like I want to help people and I get those calls and the best thing I can do is tell them like you can come see us, but we're in California. You know, you need to either fly out here or you know, something like that because we're just one doctor. We can't see every person, you know.
Yeah, I went through a really hard time when they stopped my benzos. And I only used Xanax for breakthrough panic attacks. Like I felt it coming on. It was like a month where it was my panic attacks were so much higher because I knew I couldn't treat them. Like I
Yeah.
know I don't have anything to take care of this, so now it's even worse, you know. And they put us on stuff like I take amitriptyline for my nerve issues, but it's also an antidepressant, and a lot of antidepressants kind of do both.
Isn't gabapentin horrible? Like I cannot believe all these doctors are giving gabapentin out.
So it's interesting because some states have actually made gabapentin a Schedule 1 drug. It works really well for me. And for me, the benefits outweigh the risk. But for most people, the risks way outweigh the benefits. And it is the effects that can come from that are ridiculous. And they're not just putting everybody on it, but they're replacing pain meds with it.
Right. That's
So,
what I mean.
I would normally give my patient, you know, a week's worth of Norco to deal with this broken leg, but instead I'm going to throw a big old bottle of gabapentin at them. And
Yeah.
gabapentin, that's another one that you can go into really bad withdrawal from. And yeah, it's bad.
In
Or do you
in the addiction
see
community, a lot of people overtake gabapentin and take it to, get a euphoria. When I was in treatment, I was in a sober living, and one of my roommates had gabapentin, and I would take like 4 or 5 of them at one time, and it was like you were on a boat out at sea, and it was like, and then I just fell asleep. But ugh, I hate gabapentin. Like I don't like it because it's just like one of those things that like I took it and I felt so weird and made me feel so like I was out of my body that it wasn't a good experience. But I have had a lot of people tell me that their doctors are trying to put them on gabapentin for their pain, and I'm just like, what? Why? I thought that was for like
it?
nerve pain. You know what I mean?
Yeah, it's for nerves and epilepsy, I think, seizures. Um, it's funny because see, these are the things that make it harder for us to understand you also, right? Because I get nothing from gabapentin.
I
The
know.
only thing I get from my gabapentin is that I stop getting the feeling of knives being stabbed all over my legs and face constantly because I have the nerve disease. But other than that, I get no feelings of anything from it. So it's hard for us to get it because it's like, well, what do you mean it makes you feel euphoric? Like, are you? It does
When I
nothing to
took
me.
Xanax, when I took Xanax, the moment I took a Xanax, like 2 minutes, 3 minutes after it kicked in, like it was like this warm, like, okay, Nicole. And immediately my brain would just switch and I would be like, I got to go shopping. Well, shopping means shoplifting. And I'm like walking into the Walmart high on Xanax, like taking everything off the shelves. And because it made me feel like untouchable, it made me feel like I was invisible.
That's interesting.
I was so high on Xanax, I was trying to get my husband to the ER, and I drove our car into a brick wall because I took so many Xanax. It literally works so differently in my brain. Like it makes me feel so euphoric, so euphoric. And I'm like a high strung person, like I'm high strung, but it doesn't calm me down. It gets me even more crunk. Like I'm running around wanting to do this and do that and go party. It's so different because that's how you know, like your brains are not the same. Like our brains are different. That's why it affects me differently, you know?
Lindsay, that's something you really have to talk to your doctor about because, like I said, for me, the benefits of gabapentin really outweigh the risks because without it, it would be just my body would be hell to live in. But yeah, a lot of people keep saying that. I've seen that in the comments a lot too. Should I stop taking gabapentin? Should I? First of all, don't just stop taking it. Do not ever just stop taking it because it can cause seizures. It can cause major withdrawal symptoms. So don't do that. But also, yeah, you have to talk to your doctor because we all have to make decisions, right? And for me, the risk of having dementia when I'm older versus not being able to touch my body or have anybody touch my body at all without me screaming and feeling like my skin is being torn off, the benefit really outweighs the risk for me with that. I think it's interesting. I think that it's so funny how medications work so differently in
Yeah.
everybody's body. Because I'll see people saying things in the comments too about, oh, I bet you got that warm, fuzzy feeling. And I'm like, what the hell are you talking about? I've never had a warm, fuzzy feeling from my medication in my life. Like, are you kidding? But the smallest amount of THC will make me feel like I'm floating and feel extremely paranoid. And my husband thinks it's hilarious because apparently I am really stupid and say really stupid things. And then I pass out. So that's the only thing I can kind of equate it to in my head, like,
Yeah.
and I can't imagine how that must feel too for our chronic pain patients who are in recovery.
It's hard. I
because the
can't imagine being a pain patient and taking opiates. Like with Suboxone, I don't get a feeling because I've been on it for so many years. But like, I can't, if I was like in recovery and I wasn't on Suboxone and I had to take something like Oxycontin or, oxymorphone for like pain, like that would be, I think it would be difficult for me because I love the way that made me feel. It gave me energy. It made me feel like just good inside, made me feel warm, and it made me feel like I was escaping, and I loved that. I loved to be escaping. That's what the reason why I use drugs is because I wasn't not happy where I was at. I was wanting to escape the reality that I was living in. I was
which I think
hurting inside.
that's pretty common. It's self-medicating, masking the pain in one way or the other. Mental pain is just as bad as physical pain. Honestly, it really is. Um,
But I don't want to discourage any of you guys that are on medications. Like I have such a addicted brain, or everything that makes you feel any kind of relief. If I take it, like I just want to take more and more of it. So if you are not like me, then you just need to do what you need to do so that way you're healthy. And if you have to take medication, take your medication. I have a problem with those kind of medications. I just can't.
I do have a couple of pain patients who are in recovery who have said that now, since they've become chronic pain patients, they don't get the same feeling from the very same thing they were addicted to. They don't get that feeling anymore that they used to. So it's interesting because it's like our brains know a lot, right? So it's like our brains know what our body needs. Like, I've seen people who don't need Adderall who are like on
Yeah.
an Adderall. But then I watch my stepson who has incredibly bad ADHD taking Adderall, and he's just more chill than normal. So it's amazing what our bodies and our brains know. Like, they know when something is needed.
Right. Right. Well, I really appreciate you coming on here with me tonight. I would love if anybody else wants to come on and talk about pain with us any other night. We can like schedule a live stream if you guys want to. But I really wanted to have you on because I want y'all to know that I support you, and I'm not ever going to judge people that have pain. Like I hated to see that y'all go back and forth with Kyle because I know he means well and he's a good guy. You know what I mean? But I was like, I have to say something because, there's people out there that need to be on pain medication.
Yeah, yeah. And I don't think I never thought he was coming from a place of like wanting to hurt people.
Yeah.
He doesn't understand that pushing that narrative more is hurting people.
Right.
And it's hard. It's hard because you don't see things or feel things in other people's bodies. So to him, this is what he gets from these substances. He gets high, right? So in his mind, everybody who takes it must be getting high too. So I get that.
Yeah.
And I never blocked the guy. I mean, I talk to him anytime, any day. But I do really appreciate this because, like I said, I think it is really important that we have these conversations and we listen to each other because really we're all fighting the same devil in one way or another.
I agree. And if there's anything I can do to ever help anybody in the chronic pain community, like just let me know if I can help in any way. If y'all need anything, I try to advocate for things that I believe in, and I don't believe that people should be cut off their medication. So if there's anything I can do to help you guys, just let me know. And are you okay with me putting this video on my YouTube channel? And I will link.
Absolutely. Can Pam put it on the end pain stigma one also?
Yeah, that's fine. I'm gonna upload your I'm gonna tag your TikTok in the comments because I have almost 9,000 followers over on my YouTube channel, and those people that follow me, a lot of them have chronic pain. I'm also going to put this on my Facebook and in my Facebook group and all a bunch of different groups about opiates. So you're probably gonna have some new people coming over following you. Okay.
Yeah, and Pam, just want to remind us we need help with that Matt doctor. If you guys go to NPAID Stigma or to my page, you can see the video with Dr. Tom. He is really being targeted. He needs some help. He has lost everything. And that man dedicated his whole life. He was an addict in recovery and dedicated his whole life to MAT treatment and to helping people go through recovery. And right now he really needs some help. So if you guys could even just share his GoFundMe or just, look at
Where
it,
is
give
this
$1.
page at? Is it here on TikTok?
Yeah, either you can see it on mine, it's a couple of videos back, or on the End Pain Stigma page.
Okay. I gotcha. Because I will definitely do something, because if he's a MAT doctor, then I want to help out too. Thank you so much.
I mean, this man has created laws, created rules. He has really fought hard for the recovery community, and so we really want to help him. We really want to stand behind him and fight with him too, because like I said, I will never blame addicts, and I don't want anybody else to either. We all have to work together to get through this together, and all of our doctors are important. So yes, if anybody can go check that out, we would really appreciate it, because man, this man he's an amazing man. He's done amazing things for the recovery community, and he does not deserve what they are doing to him.
I will check it out right now. I appreciate you. Okay.
I appreciate you too. Thank you.
Bye,
and I'll
girl.
see you guys soon.
All right.
Bye.
Okay, you guys. I hope that you guys that are, in here understood why I had Mel on, because, sorry, I didn't want to make it too long, because, after about an hour, people start cutting out. There's nobody to blame. Nobody is to blame. Drug addicts are not to blame. Pain patients aren't to blame. And doctors aren't to blame, you guys. These huge, big pharmaceutical companies and these people who are making the laws, those people are the blame. The big people in the suits and the ties that have the millions of dollars, that are sitting on their couches watching TV, fucking living it up in huge mansions. Those are the people who are to blame. We are in this together. And people who need pain medication, that we shouldn't shun them because they need pain medication, and people who are addicts shouldn't be shunned or treated differently either. So I really wanted to have Mel on here because I just want to show my support for people who need pain management. I totally 100% support you. I believe that opiates and opioids have a therapeutic value, and that people that need to be on them need to be on them. Absolutely 100%. If you're a person who's like me and you have an addiction, I totally understand where you're coming from, and I try to stay away from, pills and stuff. But if I was in pain, I better get treated properly. If I didn't get, I don't think they should have a right to not give you treatment because you have an addiction. So I don't even want to get started on that. That would just pisses me off too. So I hope you guys enjoyed the live stream. I am going to go wash my face and get ready to lay down with the boys, but I just wanted to have Mel on because I really support what she's doing, and I wanted to bring her here so that way you guys could hear what she had to say. So I will see you guys tomorrow night at 7:30. Now, I don't think we have anybody coming on tomorrow night, but Monday night we do. Her name is Cassandra, and she has a TikTok channel where she talks about the 8 years she did in prison, and she was in a diamond heist. So she's coming on Monday night. That's going to be real interesting. So Monday night, Cassie's coming on, and then I'm reaching out to a couple of other creators. So I'll probably have a couple more live streams with guests on throughout the week for you guys, okay? So I love you guys, and I'll see y'all tomorrow night at 7:30 p.m. Central Standard Time.